Hi, I'm Dr. Rhoda McRae. The number of older people in prison is increasing, and we know that up to 20% of prisoners over the age of 55 may have dementia. This is a big challenge for prison and prison healthcare staff because their needs are much more complex. Those with declining cognitive impairment can be difficult to identify. Little is known about this population and how they are cared for in Scotland. Our research set out to look at new and effective ways to improve the health and well-being of this group of people. So what did we do? We interviewed 20 staff and other partners working in 4 Scottish prisons. This enabled us to build up a detailed picture of how people with suspected dementia were identified, assessed and provided with post-diagnostic care. The lack of routine screening meant prison healthcare staff were largely reliant on others to identify cognitive impairment. The complexity of prison settings and the limited access to specialist staff meant that assessment and diagnostic processes could be lengthy and often disjointed. For staff, there are many challenges to meeting individual care needs after a diagnosis. We went on to identify 13 men with diagnosed or suspected dementia. Of that group, 2 declined, 5 were not well enough to be considered for participation, 1 died, and 5 were interviewed. Their own experiences, prison healthcare records, and insight from staff that worked with them helped us create an in-depth understanding of their lived care experience. Using all of the evidence gathered, we worked with a group to co-produce a model of care and care pathway. If resourced and used, these will support staff to better identify, assess, diagnose and provide post-diagnostic care and support. We developed a series of high-level recommendations focusing on themes such as implementing a model of care, dementia education, and having identified agency leads for older people. A supporting set of operational recommendations have also been made. To find out more, you can read the full report on our website.